Hi everyone. The common knee injury in a young population or young people, or so many people will say my knee got injured, my ligament is torn. So out of this so many ligaments in the knee, ACL is the common ligament that will get torn in any incident. ACL is a ligament in your knee which attaches between two bones in the knee joint, helps the knee joint in moving with balance without slipping. This is your knee. These are the outside ligaments. Once we say MCL and LCL. So inside ligaments is PCL and ACL, one is from the front. And the blue things are meniscus. So ACL is important ligament for the knee balancing while walking at 40 degrees angle, not on a level ground. When you bend your knee at 40 degrees, the ligament will protect you from slipping out or holds your knee together. It's not only road traffic accidents, okay, that's a common. ACL can be torn in any domestic injuries also, not only in the sports or road traffic accidents also. If you put your leg in a gutter, your body got twisted, and in a sports injury you try to balance on one leg, or when you skid from the bike, your entire body weight got twisted on your knee or your foot is not moving. This is a common mode of injury. Or if you miss a step or you slip on a water, this is also can give a ligament injury to you. But these ligament injuries are more commonly happens between 15 to 45 years because the bones are strong, ligament will take the strain. Ligament doesn't create any pain. Ligament is for stability. This ACL is mainly for stability. Pain is not the reason for ligament stability also. If it is torn completely. If you give rest also, we cannot recreate it. It won't heal on its own. So any tear in the joint, because joint contains fluid, not the blood, any ligament won't heal. But external ligaments, these ligaments, what we say sprain, can heal on its own if it is a partial tear, if you give proper rest in time, but not the complete tears. So unlike outside, inside ligaments are completely torn, means torn for lifetime, that's a permanent tear. Walking on a level ground, you won't feel anything. The function of the ligament is at 40 degrees angle. You will feel instability while walking or twisting movements suddenly if you want to turn, or climbing down the staircase. Occasionally if you want to run for a quick few steps, you will feel that my knee is not safe, I am about to fall sensation. That's what we say is a giving way of the knee. The symptoms are like that. Sometimes you will have a locking sensation in particular angle. Sometimes you can't bend completely. So this is the common symptoms the ACL deficient knee, means ACL absent knee or torn knee will happen. People will think surgery is mandatory or not. For few people, there is no demand for them. They can walk, their muscle power is good, they don't have any symptoms. The muscle strength should be good. For most of the people, the symptoms will be present, they can't do their activities, they will be lie down. Beyond 1 year also, they will say my ACL is not deficient, ACL is not there in my knee, but I can manage myself. But they won't do the activities. For simple walking, it won't bother you. If you want to climb up and climb down regularly, or any sports, you require an ACL. So without ACL, what will happen? It might damage other ligaments also, because a person won't fall. You will have a sensation that about to fall, or the ligament is not cooperating with you. Then other ligaments are holding your knee in a proper position, but there is a chance the meniscus tears and other ligaments might torn because of lack of ACL also in the long run, and it might result in arthritis also. The cartilage damage also happens for few people because they won't do any activities, but the weight balancing is not proper in them. So they will try to avoid so many activities. For a level ground walking, they won't feel anything. If they walk on uneven surface, they will complain my knee is not supporting. They will try to avoid this type of things. So ACL deficient knee, can it grow again? No. Any tear is a permanent tear. It never comes back. That is the important thing. If you delay it, there is a chance for other ligament injuries also. Whether it is required for your surgery or not depends upon the demand of you and the complaints of you. If you are happy in doing, I'm not an active guy, don't want any sports or something, my life is simple, I don't have any complaints, means leave it. If you have a complaint, then it is need to be addressed.